when you graduate from your medical school, you will go to any hospital, you will find a lot of applications using radiation, like X-ray or CT or MRI. If you intend to go to a place using the radioisotopes for nuclear medicine, gamma camera or PET-CT, so or CR, so definitely you will be exposed to radiation. So it's very important to know how to deal with radiation, how to protect yourself, and what's the hazard coming out from the machine you are dealing with. Okay, and in this session we will learn some basic physics of CT, computed tomography. We will not go in details. A lot of details are not important for you, but it's important to know what's CT machine, what is the components of CT machines, okay, the main idea of CT machines, what's the difference between CT machine and X-ray, okay, or different machines using radiation. And maybe the next session or next week we will talk about some common diagnosis in CT, okay. For you as a medical staff, you will see some reports from CT, from radiologists, talking about CT brain stroke or bacterial carcinoma or colon cancer. So you want to understand, and sometimes in emergency case you want to see and scroll to see the image of CT brain to see if there is a stroke or not, okay, to know the aging of stroke. I think common diagnosis for CT is important for you, okay? If you want to see some fractures or something like that, okay? So let's start now for CT basic physics. As I said to you, we will not go through a lot of details in CT, but you have to know that CT is abbreviation of computerized tomography, so we are using computer, okay, to get image. Finally, to get image or picture, this picture is ready to write or to be diagnosed. This is the main idea. Tomography is a Latin word, okay. Tomo means picture and graphy means to write or to be diagnosed, okay. Computerized, we are using computer, okay. So this term tomography, you will find it in positron emission tomography for PET scan, okay, or single photon emission computed tomography, SPECT scan. It's using gamma camera. So this term, you will find it in different modalities, or computed radiography, or, okay, so tomography is Latin words, okay. So this is a CT room layout. You will find here that this room, or you will find control room, okay, control room where the operator or radiographers or using this computer to control what's inside, okay, to control the gantry. This machine is called gantry, okay, and this is a couch or table where the patient's positions, okay, and this gantry contain source of X-ray and contain detector, okay, source of X-ray to produce X-ray, and in opposite direction, okay, you will find detector to detect the radiation coming out from the patient, okay, to detect it, to translate this radiation which are coming out from the patient to get the image finally. Here of CT, you will find here that this is X-ray source, okay, and you'll find the patient in the middle, and the radiation coming out from the patient, okay, detected by this row of detectors. This row of detectors, you'll find here certain weights of detector, different, okay. Sometimes you'll find this row of detectors reach to from 900, okay, to 1,000 detectors, okay. The row of detectors contain around 1,000 detectors, okay. Too many detectors. Sometimes here in our machines here contain 16 row of detectors, 16 row of detectors. Each one, okay, contain around 1,000 detectors. You can imagine. So this detector will be behind the patient like this. This is the patient, and the detector will be behind the patient like this. And the X-ray tube will be up, okay, and you will find the detector will be down. Okay, so the X-ray coming out from the X-ray tube will be incident on the patient. Okay, after that, the X-ray interact with the patient. Okay, some of X-ray photons. Okay, as we talked last time, X-ray photons absorbed, and another amount or some amounts will be out of the patient, will be transmitted out from the patient. This amount which is transmitted from the patient will be detected by the detector. and the detector will translate this is the intensity of radiation or the amount of radiation to image. Finally, to get the image of the patient like this. Here, this is the image of CT. Okay, here you will find different colors, not one colors. Okay, so now here you will find this is what's this? This is bone or soft tissue? Bone. Why? Sorry? Dense, more dense. This is bright signal, okay? Or white color, okay? You will find here, this area is subcutaneous fat, okay? This signal is hyposignal or hypersignal? Hyposignal, okay? Signal intensity is low or high signal? Signal intensity here is low and bone high, okay? So, if your body, if our body is composed of one material or one density material, all bone, soft tissue, fluids, or fat, all components has the same density. All components have the same density. You can imagine the image will be like this. The image of CT will be only one color because all components or all tissues inside our bodies will absorb the radiation with the same intensity. Okay, you will find here different components inside your body. This is the X-ray tube which produces the X-ray, and this is the patient. Okay, inside the patient you will find bone, you will find water, soft tissue, different components. Okay, you will find fat. Each component has a specific attenuation of or a specific absorption of radiation incident on it. Okay, according to the absorption of radiation which coming out from the X-ray tube, you have different mu. Mu, this term is attenuation coefficient. Okay, which one is higher attenuation coefficient? Bone or air? Bone, because bone is higher density, so you will find that bone has higher attenuation coefficient. So the radiation which is coming out from bone will be low intensity because bone absorb a lot of radiation, okay, but water will be less. Okay, soft tissue. Okay, according to the density of different materials, you will find different signal intensity. Detectors will be behind the patient. Okay, so you have different attenuation, which cause different signal intensity. Okay, using this attenuation value, okay, you have here different intensity coming out or transmitted different intensity. So you will calculate what's called CT number or Hounsfield unit. CT number or Hounsfield unit is mu for tissue minus mu for water divided by mu for water multiplied by 1000. This is the CT number. This is very important. Why it's very important? Because sometimes you will scan patient for renal stones. You want to know the type of renal stones, which is urate or calcium oxalate, okay, and so on. So through this CT number, you will find that each type of renal stones has specific CT number, which is called Hounsfield unit. So CT number or Hounsfield unit is very important. Sometimes you will find hemorrhage in brain. Hemorrhage has specific to differentiate between hemorrhage and calcifications using these values, your CT number. Okay, each pathology or tumors or fat contents, if you have a tissue or tumor has fat content, you want to know the Hounsfield unit, because if you want to know the composition of tumor itself, contain fats or doesn't contain fats. So it's very important to know CT number. Okay, as you are clinicians and you are sometimes reading reports, you will find this value. Radiologist indicates the CT number for renal stones or hemorrhage, sometimes using this and write this. Okay? It's clear for you? Any questions? No questions? Okay. This is CT gantry. You will find here number 1 is X-ray tube, and number 2 is the detector, and you will find here number 6 is the computer. This computer is controlling the all components inside the gantry with control room computers. Okay, it's like moderators or coordinator between the components inside the gantry and the computers outside. This is the X-ray tube. Okay, here talking about the physics, but it's not important for us, but we have to know that we have different CT generations. Okay, the first CT image, we produce the first CT image in 5 minutes. In 5 minutes. First CT image in 5 minutes. You can imagine? First slice, not whole scan, in 5 minutes. Okay, because in the past, using first generation, we have only X-ray tube and thin beam of X-ray and only one detector, not row. One detector. So you wanted to cover this slice, okay? You have to move, okay, from here, okay, to this position. After that, you will angulate or remove or change the angle to cover, to get another projection or another view, okay, till you reach to 180 degree to cover one slice. This is the first generation of CT. This is the first generation of CT. Okay, but
when was it?
sorry?
What year was it? What year of the first when it started existing?
Now we have X-ray tube, okay?
1970?
You want to start X-ray tube, okay, and detector behind the patient.
Yes, I understand. But what the year of production was it of the first CT?
I didn't get your
The
point.
date of first picture of CT. Do you know the date? 1770?
Yes, 70. Yeah, 71.
So when I started my
Yes.
professional work.
This is the first image, okay, of CT. You will get, this is the resolution is so bad, okay? Not like today. This is second generation. Second generation using fan beam of X-ray, not thin beam. Now we are using fan beam, okay, or wide beam of X-ray, and using and increasing number of detectors to reach 30 detectors. Okay, so now we can cover, okay, large area of the patients, not like before. So now you can cover or you can scan patients, okay, or scan one slice in reduced time, okay. You can reduce the time of scanning, okay. It's very important. But nowadays using third generations, okay, like our city here, a third generation. Most of cities using this generations, third generation, increasing the width, the angle or the fan beam angle, okay, to cover large area of the patient, as you see, and the detector in the opposite direction. You'll find here X-ray tube rotating around the slice or the patient, and the X-ray tube and the detector will be in the opposite direction. Now we are covering the patients, okay, in very low time. Sometimes this rotation time reaches to 0.2 seconds. You can cover one slice in 0.2 seconds. Okay. Sometimes we have now number of rows of detectors reach to 640 detectors. Row of detectors. 600, around 600. So you can cover. Now, if you have a patient like this, one row of detectors, 4, okay, 16. And when you increase the number of row of detectors, so you can cover, okay, large area of the patients in the same time. Sometimes scanning patient for brain in less than 1 second. In less than 1 second, you can scan patient for CT brain. Nowadays, okay. But this is the most common generation, third generation, okay, we are using here in our hospital. For fourth generation, so you have now, the detector will be fixed or stationary, okay, detectors, and only the X-ray tube rotating around the patients, okay, but it's very costly, okay, it's very expensive. This is fifth generation of CT. Here we are using electron gun, as you see, and using magnetic field to deflect the electron gun and using 4 target anodes. For X-ray production, you have to use cathode, anode, okay? This cathode is important for producing electrons, which move from cathode side to the anode side. Okay, after that, electrons interact with anode to produce X-ray. We have 2 types of X-ray, characteristic X-ray and Bremner-Strahlung X-ray. The most important interaction is Bremner-Strahlung X-ray, okay, which are used in X-ray or CT or CR, okay. Only in mammogram we are using characteristic X-ray. This is a physics detail, not important for us, but you have to know, okay. But here in 5th generation, we are not using anode. We are using 4 anodes. Why? To increase the beam, increase to the width of the beam, okay? To cover large area of the patient. So you can scan large area of the patient in the same time. This is the 5th generation. It's very expensive. Sometimes using 2 X-ray tube. Not 1. It's called dual energy. Dual energy CT, this is technology, okay, using dual energy CT, using 2 X-ray tube, or using 1 X-ray tube with 2 different rows of detectors. One for, each one is specific for certain kV, okay. This is very important in some applications like angiogram, okay, using subtraction or using this technique to subtract some image, okay. The aim of CT scan to expose the patient to less patient dose and to get an optimum image, optimum diagnostic image. This is the main target of CT scan. Sometimes we are overexposure for the patients, okay, for X-ray and no increasing in the image quality. The main important thing to know well how to get the optimum diagnostic image with less patient dose. That's very important. Why? We are saving money, not saving patient life, but we are saving patient life and we are saving money as well, okay? Because this X-ray tube for CT has a lifetime, okay? If we are exposing the patient to higher radiation, what's happening to the X-ray tube will be damaged in short time. If you want to replace it, you will pay a lot. So it's very important, okay? Here's some calculations for CT dose calculations or patient dose. Sometimes if you want to, if you scan patients or child, and if you want to know the dose of patients, if you want to calculate the effective dose of patients. It's important for you as a clinician. If you have a pregnant woman, you will send her to do CT scan or no?
Depends.
It depends on. You will send her to do CT scan?
Like I said, depends. The rule is mother before fetus.
Yes, depends on. If she had accident, okay, and she came to you and you will send her to do CT scan, or she's pregnant. And if you did an operation for a patient and discovered after 1 week that the woman discovered that she is pregnant, you will make an abortion for her? Or?
Depends on where the injury is, which you want to scan. If it's further away from the fetus, then you could cover the abdomen with probably lead jacket or something to prevent the X-rays from.
A lot of factors are affecting to take a decision, okay? First of all, you have to know, you have to detect or you have to determine or you have to calculate the effective dose, okay? The dose of patients. That's very important thing because you are a clinician, okay? And if the patient exposed to radiation, okay, who will guide him? You you will tell him it's important to do an abortion or not. Okay? A lot of factors affecting on your decision. So later on we will talk about it in details. But first of all now, so you have to know what is the patient dose. How can I calculate it? Okay? To calculate the patient dose, so you have to differentiate between three terms. Absorbed dose, and equivalent dose, and effective dose. Absorbed dose, equivalent dose, effective dose. If I have a source of radiation, this source of radiation, okay, will produce X-ray, and you are here. Okay, so now you are exposed to radiation. Okay, you are exposed to radiation. Okay, this radiation which is coming out from the X-ray tube, causing ionization of the air, causing ionization of the air. This ionization will be mounted or be calculated to produce exposure dose. Exposure dose. So now you are exposed to a certain value of radiation. You are exposed to certain value of radiation, but your body absorbs the same value? Is your body absorbs the same value? No. No. If you are exposed, all of us are exposed to the sunlight. Okay? But our body absorbs the same amount of exposure? No, different. This is the same idea. You are exposed to the radiation coming out from the X-ray tube. You are exposed to it. It's called exposure dose. But if I want to calculate the absorbed dose, what's the amount? How much the amount you are absorbed? Your body is absorbed. Okay. So it's very important to differentiate between the exposure dose and the absorbed dose. Absorbed dose means the amount of energy absorbed per unit of weight or mass. Okay? Amount of energy, because the radiation is energy. This energy is deposited in your body. Your body is mass. So the amount of energy absorbed per unit of mass is called absorbed dose. The unit of absorbed dose is called Gray, which is joule per kg, per kilogram. Joule is a unit of energy and mass is the